In this week's interview, Dr. Anand Atal will be talking to Dr. Shiv Kumar Varma regarding the history, practice, and science of Ayurvedic medicine.
Dr. Shiv Kumar Verma,
Yes.
I'd like to welcome you to Aaradhna. And I know this is your first visit to Aaradhna, but I'm very excited about the interview.
Thank you.
Dr. Verma, I know you are fully qualified in Ayurvedic medicine.
Yeah.
And I also understand that you have been practicing Ayurveda in Vancouver for last 10 years.
Yes.
Could you tell us a little bit about yourself, your personal background, and your professional background?
I'm born in Kerala. It's in South India. And from very childhood, my parents both were Ayurvedic physicians. And I grew up in an Ayurvedic family like that. And then later, I was quite interested in studying Ayurveda due to their influence. And I took Ayurveda. And that is it.
How long did you study Ayurveda and who was your guru?
I studied for almost, I separate 8 years.
8 years.
And of course, all my life I was living Ayurveda. And my guru is Narayanan Nambudiri. He's my guru.
Is he still living?
He's not. He passed away about 3 years ago.
3 weeks ago?
3 years ago.
Yeah. Well, I'm very happy to have somebody answer some of the questions
Yes.
for us. So could you tell us how old is this science, what you call Ayurveda?
Ayurveda, according to Hindu beliefs, it is beyond time. It is from the Brahma itself. And Ayurveda, from the present historian standpoint, it looks like more than 6,000 years ago. Some of them says it is 10,000 years ago. Some of them says it is even 20,000. But for us, it's one of the oldest recorded system of medicine now practicing.
So you are practicing this very, very ancient art.
That is true.
What kind of ailments do people bring to you when they come and pay you a visit?
According to Ayurvedic system of medicine, all the different type of ailments that which we have is divided into 3 sections. And people generally come right now for due to degenerative diseases like diabetes or arthritis or fibromyalgia, people like that, or obesities and depression. These are the main things that people just come.
I understand Ayurveda is a holistic medicine,
Yeah.
holistic way of healing.
Yeah.
How does it differ compared to other prevalent contemporary holistic medicine techniques?
Holistic, when we compare different system of medicine which they say holistic, I think from my point of view personally, I think there is only one system which can really say that is holistic, and that would be Ayurveda. Because holistic is whole, looking at something from a whole perspective. And that I am able to see only in a system of medicine is in Ayurveda. Holistic is word used now widely by different system of medicine, but let us look at what is holistic. From one point of view, like let us say a naturopathic, for example, and then we are still using herbs, so that we are not using synthetic and other medicines. We are using herbal medicines and vitamins and minerals to treat disease conditions. But still we are treating disease, we are not treating the person. We are still looking at a disease perspective and then trying to treat the person. And we look at, for example, other system of medicine like even homeopathy and other system of medicines. But still they are looking at the disease.
They are looking at the disease.
And trying to treat the treat. But Ayurveda is only one system of medicine which really treats the person. And disease becomes a secondary. So we are treating the person. So when somebody comes and asks, I have a headache, we are looking who has the headache. That is the difference. So we normally other system of medicine, there is a medicine already there for headache, and that is given.
Mhm.
But Ayurveda looks at it in a whole different way. It says who has the headache and why is this headache is there.
So you don't have any magic bullet like modern allopathic system
No, we
has.
don't have a magic
You
bullet.
treat the body.
We treat the person, we treat the
Therefore,
body.
and you treat the whole body.
That is true.
Therefore, you are saying that's the truly holistic.
That is why we
system.
treat the whole body. That is a very, very right way to express. We are treating the whole body, we are treating the whole person, and that is why we can really call it as holistic.
So can you comment on some other aspects of Ayurveda
Yeah.
which will indicate to the viewers
Yeah.
that it is a very comprehensive system of treatment?
Now, one of the very easiest way to explain to anybody about Ayurveda is that all the system, all the type of diseases that can happen, they have divided into 3 different root causes. One of them is that either you can have a disease that is originating from dryness, or you can have a disease that originates from acidity, or you can have diseases that can come from fat or mucus.
So you are talking about those 3, Vata, Pitta, and Kapha,
That is
which
right.
are very familiar terms
Yeah.
because of all the books written by
Yeah.
Deepak Chopra.
Yeah, that is true.
Is there any connection between your system and what Deepak Chopra, well-known holistic master,
Yeah.
His system? Is there any connection between the two?
In fact, the whole expression of Deepak's work is completely based on Ayurveda.
Mm-hmm.
So it is just, and Deepak has really done an amazing job by bringing this Asian knowledge and able to interpret that into modern time words. Has done a marvelous job in that regard.
And he has also been associated with that institute in California somewhere.
Yes, yes.
Yeah.
He has a very good center there.
Mm-hmm.
Yeah.
Now, how do your patients get the medications? Do you have any medications for them? When you treat them, as you said, you treat the whole body.
Yeah.
Do you offer them some kind of medication?
We give mainly lifestyle changes, so it includes dietary changes. If the person is very acidic, of course we would say, okay, you must keep away from acid food. And then if somebody who is having very obesity, then we say, please keep away from the foods that would create, or lifestyle that would create that condition. That's one thing. Second, we use a wide variety of herbs to address the condition. And then we also use abundant amount of oils externally as well as internally to create balance.
Again, all along you are treating the body.
That is true. Yeah.
Where does one buy these medications like oils and this? Are they available around?
It is
practice?
yeah, it is really available. We have a wonderful store here, as well as one amazing thing. Ayurveda is just principles. And once you know the principles, you can use the herbs and vitamins and minerals and supplements that is available anywhere in the world, and can use that as a medicine.
Can you suggest one such principle which we can kind of use to understand your system a bit better?
Yes, in Charaka says very easily that there is not even one single thing that cannot be used as a medicine. Everything.
That's right.
From a word, from a sweet word to a care touch, to a proper environment, and through food and so many different ways that we can really treat a whole person. And the effect is amazing.
So it depends upon how it is used.
Yes.
Everything has some
Yes.
medicinal properties.
That is right.
That's what you are saying.
That is right.
What is a probiotic compared to antibiotic as far as Ayurveda is concerned?
Probiotic to antibiotic, it's an amazing thing. In fact, very few people are even aware of these two divisions. As a disease care system, we are more focused on antibiotic. But when you look at for health care, I would say when our health system as a whole, and if the awareness among the people and the society, if our focus is more on health care, then I would say we will start searching more on probiotics, because probiotics is that what helps us to create the beneficial flora. That is the organism that helps us to really digest the food, and the food that which we are able to eat, and able to absorb the food into our body completely based on probiotic science.
Let me make sure I understand you right.
Yeah.
Antibiotics, I know they destroy a lot of useful bacteria in the body.
Yeah.
Some of them are needed to digest food and
Yeah.
carry out other body processes.
Yeah.
Are you saying that probiotics are
Yeah.
designed to not kill them but stimulate their growth?
That is right. Probiotics are basically replacing the beneficial bacteria back again into your system.
So this is one of the chemicals you use
Yeah.
to bring the body back in tune.
Yeah, of course.
Yes.
Because if you have enough flora in your system, then your whole digestive system is proper, and the nutrients and the herbs and that you take, that becomes absorbed into your system properly, and you start getting life.
Let me bring you back to Vata, Pitta and Kapha, because they are fairly new terms for a lot of people.
That is right.
Leaving aside people who are familiar with Deepak Chopra's work.
Yeah.
What is Vata, for example? Vata means Vayu or air. Is that-
Vata, I would say, is the principle of moment, or wind humor. Vata dosha, wind humor. Or it's another way we can say, an easy term is that the principle that creates dryness in your whole system.
Can you give an example, some more specific example?
Let us say a person who has dryness. Of course, this is a very, when we read or when we talk, these terms are very difficult to really explain, because we have to go through it. But in a very easy term to understand is that were about 84 different type of dryness related diseases is there. So somebody can look into this and say, do I feel dry? My nails are dry, or my lips are getting dry?
Skin is dry.
Skin is getting dry.
Yes.
Or in further, the person can get dry and say, oh, I feel that I feel numb. My hands and feet are really cold. No, I just feel that my circulation is really getting poor, and I can have my whole feet is getting numb.
Oh, that is also Vata?
That is all Vata.
Mm-hmm.
No, or I have always back pain, and that is Vata. No, I have joint pains, and my muscles and bodies are all aching.
Oh, so you are talking about arthritis.
Yeah.
So arthritis is because of Vata problem, is it?
We have arthritic from Vata. Arthritic is there, Pitta arthritic is there. Through acidity also you can have arthritis, or you can have mucus and fat. Kapha arthritis is also there. So arthritis can come from different ways, but wherever pain is involved, then you can say, no, that is coming from Vata.
It means there is some problem of circulation in that part. Is that the way, because blood carries the moisture to different parts of the body? Oh, I understand that a bit better. Now, can you comment a bit about some medicinal values of certain foods we consume in the context of Ayurveda?
Medicinal values of foods that we take. Simple would be the spices. We'll start from probably spices would be an easier way.
Could you take any spice?
I would say turmeric, for example.
Turmeric,
turmeric is which I think every Indian home would have turmeric. And the turmeric have very high medicinal value. First, it can be used to regulate sugar in your system. And it is a phytoestrogen, so it is a very, very good for hormone balancing in women. And it is very good for tumors and cysts and fibroids. It can be used, so that is very, very, in that regard also, it's very good for women. And it is extremely good for edema, like water retention in the body. So it's a very...
So it sounds very useful.
Very, very, very useful product. And it is also a mucus balancing, so it's a kapha reducing. So when a person has a lot of mucus and phlegm, then turmeric can also be used to regulate that. So because of these reasons, turmeric was used by olden days in Indian cooking.
Well, even today,
Even
I
today
think
we
most
can
of
say,
us
yeah,
put turmeric in
turmeric in
virtually every
every
vegetable
Yes,
we cook, you
yeah.
know. So is that enough quantity to cure a person? Or?
I would say, though we are using the spices, I think, but in the last 100 years, we are cooking in a whole different way. Everything is now processed. So our rice are processed, then the oil that we are using is highly processed, and the cooking style of us is completely changed.
Yes, it is. Yes.
And we are using more ghee. We are using more other oils like processed oil in cooking instead of ghee. I think.
Just for the sake of viewers, what ghee is your
Ghee is a clarified butter.
Okay.
Clarified butter. When I came to Vancouver, ghee was not available anywhere, and I was telling different companies to really make ghee so that it is available everywhere. One of the reasons is that ghee can withstand a very high amount of heat. So in olden days, all our cooking is done in ghee, which is clarified butter. And we would never use other oils generally for cooking. Then the other oils are used after the cooking is over. We pour the oil on the top of it, and that is the way. And most of the frying and all is again done basically in ghee. But now that is changed. People are using now quite a lot of other oils, and most of the oils are extremely heat sensitive. So then it creates, instead of the good effect, it creates the bad effect. So coming back to the turmeric, which you said, turmeric you have to really use, if it is properly used, you have to use it with the ghee. You have to, when we are spicing it, we have to use turmeric, and at the end of the spicing, like you put mustard seeds and you put all other spices, and you have to put then turmeric in the end of it.
Dr. Verma, obviously, in view of the fact that you know so much about it, I don't think a 15-minute interview is enough. No. So I thank you very much for this segment of the interview. I think in the next part,
Yes.
we are going to discuss a few more aspects of Ayurveda with you.
Thank you.
Thank you, Dr.